Good afternoon. My name is Nannette Newcomb, and today I'm going to take a few moments to speak to you about the nurse theorist Malaise and her theory on transitions, which is taught in your NUR 455 course titled Nursing Theory in the University of Mount Olive RN to BSN Nursing Degree Program. This video is an assignment for my Master of Science in Nursing Degree Program at the University of Mount Olive. The goals and objectives for this brief lecture is at the end you will be able to briefly describe Malaise's theory of transitions, describe the three types of transitions that are related to health and illness, describe why transition is important for nursing, and give an example of a transition that patients may experience and an example of how Malaise's theory can be applied to everyday nursing practice. As we get started, let me give you just a brief overview of Malaise's theory of transitions. Malaise's research focused on individuals who do not make healthy transitions, along with the discovery of interventions to help facilitate those healthy transitions. Transitions are triggered by critical events or changes in our lives or the environment. This morning we received a phone call from a neighbor that experienced a major transition in his life as he had a stroke yesterday afternoon. This stroke has left him paralyzed on his left side, where he's unable to speak or unable to walk. Just as our neighbor, nurses go through these types of transitions with patients on a daily basis in relation to their health, their well-being, and ability to care for themselves. The three types of transitions that nurses go through with patients are developmental transitions, situational transitions, and health illness related transitions. In developmental transitions, these are experienced by the person or maybe by a spouse, a parent, or child in caring for one that's diagnosed with a health condition. Situational transitions can occur through the birth of a child, even the loss of a family member. And your health illness related transitions occur through having an acute or a chronic illness. Transition is very important to nursing because nurses spend most time with their patients, caring for them and their families, providing coping skills as they experience changes that affect their health. As patients enter the hospital, they go from the admission transition to the rehabilitation transition, through the discharge transition, and even the recovery transition, that they may experience complications and setbacks and readmissions if they are not cared for properly during these times. As a patient is diagnosed with diabetes, it requires education as the patient learns to transition, to eat differently, take their medication, check their blood sugar on a daily basis, or administer insulin. Malaise's theory can also be used with us as nurses as we go back to school to further our education. This is a transition. Even when we move to the role of a supervisor or a manager or a charge nurse, these are transitions that Malaise's theory can help us with. Malaise's transition theory can also be applied to everyday nursing practice as we provide the attention and caring that our patients need. Also, when we explain health and illness transitions, such as the recovery process after a major illness or what we need to do upon discharge from the hospital, we can also coach and support our patients through these major life transitions. Today, as we have discussed Malaise's theory of transition, you should now be able to briefly describe the theory, describe three types of transitions that are related to health and illness, describe why transition is important for nursing, and give an example of the transition that patients may experience, and give an example of how Malaise's theory can be applied to everyday nursing practice. For more information on Malaise, you may refer to Martha Alligood's Nursing Theorist and their work. Thank you for your time and attention today, and I ask that you please complete the short survey that's provided to you through the Nursing Student Center and email it to my professor, Dr. Carolyn Robinson at chrobinson@umo.edu within the next 3 days. I hope you have a great afternoon. Thank you.